Hi, happy day. Welcome to Lighthouse of Broward's YouTube channel, Coffee Sessions with Pat. This channel is going to be all about how to perform activities of daily living in a safe, efficient, and independent manner, where once we were probably able to perform them relying on our vision, we are going to learn about many tips, tricks, techniques, skills, and look at various adaptive pieces of equipment to be able to perform these activities in a different way, but in a safe, efficient, and independent manner. My name is Patricia Roldan. I am a vision rehabilitation therapist and certified orientation and mobility specialist. I am glad you are here with me today. So the first thing we're going to cover, as mentioned earlier in this video, is how do we determine what medication we have in a specific container? And again, these methods will work whether it is to determine and identify over-the-counter medications or prescription medications. One of my first recommendations is to keep some sort of tray, container, Tupperware if there's nothing else at home you can use, to place your medication bottles on top of them, because many times when we do attempt to open up a prescription bottle, pills will fall out, and now we are left with the challenge of having to explore in a larger area where that might be located. A simple solution would be to take a tray, just as I have here. It is a dark colored cafeteria tray where I can set all my medications and either choose to organize them, or I can just simply have it as a way to contain any spills that might happen as I attempt to take them out of their corresponding bottles. Every medication will be provided in a different shaped bottle. While that might not always be possible, there are other ways that we can explore. When you are exploring the different shapes of the bottles, it's a good idea to feel how tall it is in comparison to the other medication. Is it round? Is it square shaped? Does it have a pretty thick cap? Does it have a thin cap? All these features, as you are exploring the details of the actual bottle, should help in terms of identifying what kind of medications you have. It will not always be the case, especially if you have several prescribed medications, which tend to come in that same shaped cylinder bottle that most of us have at home with prescription medications. Another tip in terms of exploring what might be inside each bottle is opening the bottle and exploring the actual pill. We're going to be looking at pill size. Is it round? Texture? Is it smooth? Is it a gel capsule? Is it thin? Is it thick? Even if the actual prescription bottle has a smell. Sometimes antibiotics will emit a very strong scent. And for many clients, it has been helpful in terms of identifying what scent that specific medication emits. Another option is to shake the bottles. Depending on the type of pill that might be located inside the bottle, they should produce different sounds. Besides exploring shape of the actual pill bottle, shape of the pill, texture, size, sound, and scent each medication bottle may be emitting, there's also ways that we can adapt, mark, and label some of these medications. If we have low vision, one of my favorite ways is by creating your own large print. If your medication bottle has a white cap, for those of us who have low vision, additional bright lighting such as an LED lighting and contrast is going to play a major role in all our activities of daily living. I have on this vitamin bottle with a Sharpie created a large print capital C so that someone with low vision, when they take out their bottles and determine which one they need, they might be able to recognize the dark, bold, capital letter C and determine that indicates their bottle of vitamin C. Another way of doing it is by using tactile markings, such as bump dots. This idea helps when we have a few medications to identify. The idea is that when using labels, less is more. We do not want to overmark, overwhelm, and forget what these tactile markings mean if we have several medications that need to be adapted. Rubber bands are another great way, practical, inexpensive, of being able to use them as labels and markers at home. In this situation, I have two prescription bottles that look the same, feel the same, and possibly have the same exact shape, texture, pill inside. If there were no scent from each one of them, we'd have a difficult time determining what they are. Take a rubber band and determine which one of the two bottles am I going to place the rubber band around in order for me to use that as a marking to identify the medication. We would be able to take one of these bottles using an app such as Seeing AI to determine what the label indicates. We can also have sighted assistants simply help us arrange and identify our medication so that then we can go ahead and choose which bottle we are going to put the rubber band around. In this case, I have decided that my bottle with my cholesterol medication has the rubber bands placed around it. My amoxicillin, which is my antibiotic, comes in the same shape bottle. I leave with no rubber band. In the event I need to identify my cholesterol medication, I am only feeling for a bottle that has a rubber band. For those of you who can identify color, it can also be a great way of helping to label and identify medication where we can implement or where the bottles are already color coordinated, such as 2 medication bottles, which are both vitamins that I have in my hand, where the caps of the bottles are different in color while the size and shape of the bottle is exactly the same. In the event that your bottles do not contain any color available to you in order for you to use that as a way to identify them, we can always purchase different colored Sharpie markers and be able to color in the cap with the color of our choice, as long as we can remember what color indicates what medication. If we are someone who relies more on tactile identification or markings, it is also a good idea to purchase or look into obtaining foam-shaped raised tactile letters. What I have done is simply taken a piece of foam, cut it out into a large capital letter T shape, and simply stuck it on the top of my cap with tape, crazy glue, or any other form of self-adhesive you may have at home. If we are able to, once again, identify color or even large print, this would also be a nice way of being able to visually identify that green colored large capital T-shaped letter in order for you to identify your own medication in an independent manner. You may also have the option to ask your pharmacist for large print labels. If you have low vision, this is something that we can request either directly from our pharmacy or our insurance provider. Thank you so much for being here with us today. We hope you've enjoyed and learned a little something during today's mini session on medication management. If you are interested in our services, I want to share that we are located in Broward County, Florida, and our phone number is 954-463-4217. Please don't forget to like, comment, and subscribe down below, and also please join us and follow us in our other social media pages so that you can continue to be a part of our wonderful journey.